Hello, Toppie Faurie. Welcome to the show. We're talking about coding. We're talking about non-payment. We're talking about fraud prevention. This is going to be an exciting show. We'd love to hear your feedback as the audience. Leave your comments down below. Let us know what you thought about today's topics. And if you have any questions for Toppie afterwards, just let us know. Just pop it in the comments and we'll see if we can get an answer to you. Thank you so much. Toppie, very, very welcome. It's wonderful to have you here.
Thanks for having me.
Absolute pleasure. I think the best place to start is to tell us a bit more about Codicom and where the idea, the kernel from that inception, when you had the idea and inspiration. Tell us your origin story.
Yeah. Look, it's actually funny if you think back of how we started with Codicom is we have to start with my journey almost 10 years ago when I got married to a surgeon and she told me, that she's got financial difficulties because the money is not coming in. For me, as in we spent 27 years in the police and security industry, knew nothing about the medical industry. And so I joined her practice way back in 2016 and started investigating, all of these challenges to find out, why are the medical professionals not getting paid? And I must admit, I've never seen an industry that is so rampant with non-payments. It is astounding. So after all the years of really studying late nights and doing analytics and analyzing this behavior, analyzing that behavior, I found that there's actually only two things that can be blamed for this. And the one is that the medical professionals, I need to word this right now because I've got the utmost respect for them, they don't spend enough time on the actual coding aspect of their practice. And when I talk about that, I'm talking about, communicating with the correct codes, be it diagnostic or procedural, with the schemes. Because if you think of somebody that tells a story, that is what a medical coder is. And because we have to tell the medical aids, why this patient came in for an episode of care, what interventions were done on this patient to end the episode of care, basically, so that they can make a decision on the funding. And I've seen, some of the coding when I was still actively doing medical billing for some of the healthcare practitioners. And I must just say this, I stopped doing billing because the whole Codicom listing service came over my path, and that's my main that I focus on now. So, I think, the medical professionals, they, first of all, in their defense, when they, after, let's say, a surgeon, for instance, if I can use that as an example, studied for 13 years to become a surgeon, coding was never in their syllabus or anything like that. It's something that they have to learn on the run, while they're operating patients and looking after the welfare of patients. So I do feel for them. But you know what? There's a common perception out there that people can just basically throw a code at the medical aids and hope they're going to get paid. And unfortunately, it doesn't work that way. You have to physically tell the story, explain all the detail to the medical aids in the codes. And the other thing that I found, and this was just shocking, is that patients you can, as the HPCSA requires, give them a quotation before the treatment so that they can understand, what they basically in for when it comes to the expenses. But with patients, there's a small minority of them that they have the intent of absolutely not paying their accounts. It's not because they're
Really?
financially. I promise you, and I'll give you some examples. So currently, there's no recourse really for these patients because all they do is they go to, if I can use a doctor, for example, they go to Dr. A, not paying. And then when they get sick again, they go to Dr. B because Dr. B doesn't know a doctor that this patient didn't know pay Dr. A. And, and then he doesn't pay Dr. B as well. One of my clients a couple of years ago, this is a great example. I had a lady that came in and she was basically in hospital for 4 days, complaining of abdominal pain. So they did all the tests and investigations on her. And at the end of the 4 days, they actually discharged her because there was nothing really wrong with her. So what happened with her medical aid is her medical aid paid her directly. So no one got paid. Apart from the fact that she got free boarding and lodging for
Wow.
she actually got a huge lump sum of money that the medical aid paid to them. And then there's actually currently, what are your options? You can blacklist someone, and still not get your money. You can hand them over to debt collectors, and take the risk, of being reported to the HPCSA. Because I'm not saying all debt collectors are, there's a wonderful debt collector that we use for one of the practices I'm involved with. But some of them really have a bad reputation. And, so you're exposing yourself to other things. I mean, you can go the legal route. You can try and sue someone, take them to court. But I mean, the expense in that almost supersedes the amount of money that is outstanding on that. And those people that don't want to pay with the intent, they know that. So what we've done at Codicom is we've closed the gap. So if you go to Dr. A and you don't pay Dr. A, and Dr. A belongs to Codicom, then Dr. A lists you on the Codicom website, which is only accessible to people registered with the HPCSA. So anybody, a doctor, a physiotherapist, biokineticist, name, if you are registered with the HPCSA, you can belong to Codicom and you can list people if they don't pay. Do you warn your colleagues about somebody that is an absolute financial risk? But you're basically getting the patient to just settle his account, or at least just make a payment arrangement and say, listen, I cannot afford this. Can I pay you 50 Rand a month or whatever? I've seen doctors make a payment arrangement for 10 Rand a month because they are so desperate to get their money in. The service was delivered, now you can't pay. So, yeah, like I said, we've closed that gap. B is also registered or subscribed to Codicom. Even before that patient comes in, his staff can see, and if that patient is listed on the Codicom website, and all the history of the patient will come on, not medical history, but the notes from the system, how many times he's been contacted, and all of those things. So yeah, so that is what we do at Codicom, and I think it's an absolute game changer in the medical industry. Without being too arrogant about this,
you're somewhat biased, but it does seem like this is the kind of thing. It's an idea whose time has come. I'm sure many a medical practice owner would just love to welcome you into their practice to help them prevent fraud, prevent loss of income, and also to make sure that they get their money's worth when they are spending their time. After all, they studied as long as they have.
And I mean, they deserve this. The common perception out there is that people think that doctors have a lot of, and forgive me, the physiotherapists and all the other people, if I always refer to doctors, but when I say doctors, I mean everybody registered with HPC. They think they've got, there's two things that they think that they have, and it's time and money. I can guarantee you, being married to a surgeon myself, I can guarantee you that is so far from the truth. It's unbelievable. So people think that the doctor will just write it off. Why must the doctor write it off? If you receive the quotation before the time and you've accepted the quotation, at least pay the service provider. I mean, you don't go to Woolworths and buy a lot of things and just walk out and say, no, I'll pay you next month. It doesn't work like that. Why does the medical industry have to work like that?
That's a great question, a great example. From the sound of it, Codicom is definitely going to be a game changer, and is already a game changer to many practices. Could you tell us maybe why you think that coding is such a recurring issue in private practice? I mean, you mentioned it's not getting taught, but are there any other reasons contributing to that misalignment? Is there a lack of knowledge out there? What are some of the issues contributing to wrong coding?
Yeah, I think a lack of knowledge is most probably the biggest driving force behind this, and the idea that you can think that the medical aid just needs one code, to pay your account. It's not that. If everybody can change their mindset to a mindset where you have to basically tell the story to the medical aids, if everybody can have that mindset, they will understand one code is not going to do it. Okay, yeah, sometimes like an appendix, a K35.3, for instance, which is acute appendicitis, I think with peritonitis, if I remember correctly. I hope there's no coders watching now. But so, then it can be one code. But I mean, in all my presentations that I always do, I always urge the people to code the comorbidities. Tell the scheme exactly what I mean, your comorbidities. And for those people who don't know what that is, a patient might come in with an appendicitis, an acute appendicitis, but the patient might also have diabetes. That will have what's the right word to use now? Influence on the resources that you use, and you need to explain that to the medical to the scheme. I mean, if somebody comes in with pain in the abdomen, for instance, and they are admitted into ICU, and intubated, ventilated, all that stuff. And you just say pain, abdominal pain, or I can't remember which one is that. But the scheme is going to ask you, but doctor, why was this patient admitted into ICU? And then what did the scheme say? They say write a letter of motivation. And all the healthcare practitioners out, that is the one phrase they absolutely hate. Because I can also understand, and again, this is also one of the things that has a huge impact on the coding side is they are so busy, and rightfully so. I mean, if you take away all of the stressful aspects of dealing with this patient's health, and there's the other patient is also waiting, and then you've got the family coming in that wants to understand, what is wrong with their family member. So they work in a very stressful environment, and which I absolutely appreciate. And the admin, most of them, they just want to get the admin out of the way so they can go back to their patients and do what they actually studied for. And what I always say to them, spend some time in your admin. If you have a big practice and you're not doing the billing yourself, spend some time with your clinical coder. Tell them exactly what is wrong with this patient so that they can code accordingly. So you don't have to come back after theatre at 11 o'clock at night and sit and write letters of motivation because you haven't been paid. And this might sound a bit rude, but it's not meant to be like that. If you do it right the first time, you won't have to do it again.
That makes sense, Toppie. Now, you mentioned about non-payment, and you said it is actually quite rife within healthcare. What do you think leads to that kind of mindset? Are there any systemic issues or something within healthcare or private practice that allows that to happen? I'm just trying to figure out what's causing it, because it does seem like it's really way more rife than I thought initially.
It is absolutely. I mean, I was shocked. And when the more I became educated in this industry and the more clients I took on, the more I got shocked. A couple of things have an impact on this, and I think we can go back to the fundamental fact that the patients think that the doctor has a lot of money and he's just going to write off this money. People think that doctors sit once a year and say, okay, let's write off 5 million rand. Nothing can be further from the truth. It doesn't happen like that. The doctor also has a receptionist to pay. The doctor has rooms to pay. Doctor on the money that is invoiced, the doctor has to pay VAT from that money. And the worst of all is sometimes the money doesn't even come in, but he's already paid VAT from that. Yes, your accountant can sort that out later with a loss to the company. I don't want to get into that. I'm not an expert on that, but it's just a lose-lose situation. I think the South African medical industry has become a place where people just accept that they don't have to pay their account. That is a common perception, and that needs to stop, because that poor doctor, when he gets home at 11 o'clock at night, he has to go and eat something. There must be money for food for him at least. If nobody pays then, and like I said, I've never seen an industry, and in my years in the police and security and stuff where we did investigations for people, I worked in a lot of different industries, and nothing like the medical industry. I'm not here to brush up anything with anybody, but I think the doctors are also scared or are being threatened by the HPCSA. I've had patients that have phoned my clients and said, if you blacklist me, I'll report you to the HPCSA. So, I mean, if you get reported to the HPCSA, that is a process that will take at least 2 years to sort out. And some of the patients know that, and they play that card to not pay their accounts. But if the doctors, and I really want to urge every single healthcare practitioner in South Africa and everybody that's listening to your show today, that if you have time, go and study the ethical guidelines of the HPCSA. It is actually shocking, the amount of people that actually knows what is in the ethical guidelines of the HPCSA. The HPCSA gives you tools to help you with your practice, but no one uses it. That's why, in 2023, that's how I came across the Codicom listing service, because it's in the ethical guidelines for the HPCSA.
You mentioned the HPCSA, the guidelines that they have. Is there anything significant that you'd like to highlight to medical practitioners that you think they really need to know?
But the one thing that actually stood out for me is the HPCSA actually says that the healthcare practitioner has a right to decide who he wants to render a service to. Now, ask any healthcare practitioner that you know if they knew that. I'm telling you now, 1% will say yes, they knew that. I'm not talking about emergency cases. I mean, emergency cases, you have to help them and so on. But I'm talking about when somebody makes an appointment with you for next week, Friday, and you don't want to treat that person, the HPCSA says it's all right, because of various reasons. I mean, maybe you could have seen on the Codicom website that he owes 5 other healthcare practitioners money. So he's a financial risk and he's just not paying. It's your right to say no.
Wow, that is interesting. So we've spoken about the financial impact of doctors, the assumption within some sectors of the population that doctors have just got tons of money and tons of time, which is not the case. I could totally attest to that, having seen and met with many doctors. But you also mentioned a lot of deductions and things they have to pay. They have to pay all kinds of certifications and licensing fees. Let's just take the impact of, wrong coding. I remember the first presentation I saw that you presented on this topic. And I remember it was quite a significant amount of money or percentage that people or doctors do leave on the table when coding wrong. So that's one aspect. Maybe you can just touch on what percentages are we looking at or what numbers are we looking at? And then secondly, the non-payment aspect. If you add that to the mix, how much of an impact does that have on top of wrong coding if you look at the average medical practice?
Yeah, you know what, Stian, I'm gonna take an example for you of what I've done or presented last year at the ENT conference at the CSR, and I actually had a graph where I worked out, how much money is your doctor actually taking home? How much percentage of the total income is he taking home? So if you take with the requirements of the HPCSA, where you there's only certain companies you can register if you're a healthcare practitioner, like Inc. and all of those things, and most of them come with a 45% tax bracket. So if you don't have a good accountant that can claim back everything that he can claim, half of your income is gone, 45% gone. Then your miscellaneous expenses, like your rooms, your receptionist, your staff, your subscription to your society, that is about another 25% of your income. You're averaging between 17.5 and 20%. Now that is money that you are not going to pay, but that is money that you're supposed to take home. But then the patients don't pay you. The schemes don't pay you. So a huge chunk of that gets eaten up as well. I don't think people understand the importance of accurate coding. I don't think so. Definitely, every time a practitioner contacts me to come and do an evaluation on their practices, it's always the same thing. I know exactly where to go. Exactly, because it's always the same mistake everywhere, and it's your coding. You can remember that example that I used here, that lady that was ventilated and intubated. The doctors would have lost almost 8,000 rand on that one page. I cannot wrap my head around it.
Multiply that by, let's say 300 working days in a year.
That's a lot of money. I wish someone would pay me that. But the fortunate thing about this, and this is something that I'm really passionate about and excited about, is that this is fixable. You can fix this. Educate your people and whoever does your billing. If you do it yourself, educate yourself. Imagine the scheme telling you, listen, we're not paying for this trying to pull this and this rule. And you have to accept it because you know nothing better. But imagine if the scheme says to you, we cannot pay this because of this and this rule. And you say to them, but you are misunderstanding the rule. This rule and this rule says this. This is what it was paying. That's a nice position to be in. And I always use this example when I qualified as a advanced clinical coder. A lot of the patients would phone us and say, but the scheme says you've used the incorrect codes, when that's why they're not going to pay. And, in the beginning, I suppose I was a bit arrogant, but, for me at my age to study that late at night to become an advanced clinical coder, I think it was, I had the right to do that. So I would phone them and say to them, listen, okay, you're saying I'm using the incorrect codes. What is your qualification? And they would say, no, they've got no coding qualification. I said, so how can you say that? So, put your advanced clinical coder on the line. And when I qualified, I don't think we were even 100 in the country. I know there's the big hospital groups have got a huge drive with us now, where they actually expect their case managers to be advanced clinical coders. But when I qualified, there was not a lot. And
back then, you knew the answer already. They'd be like, we don't have one of those.
Yeah. And the thing is, Theon, it's not about me. What the point that I want to make is such a nice position to be in. When you speak from a platform of authority, it's a nice position to be in.
The position of strength.
Absolutely. And I mean, everybody can do this. Really, everybody can do it.
I mean, it's a cliche, but it's true. Knowledge is power. And I think in this case, it's very true. Knowledge is power and it's money. Maybe you can speak to us about Codicom a bit more. You can unpack a little bit more about, I think, Codicom, for those that don't know, who don't understand the process in the listing. Maybe just unpack a little bit more, let's say, the debt collectors and the blacklistings. How is Codicom different? What does Codicom make it unique?
Okay, so what we do at Codicom is you must obviously follow your own internal collection process. So for those of you who don't understand what the team collection process means, is when you get paid by the medical aid and there's a shortfall that the patient is liable, that is your process that you follow to get them to settle their accounts. That's your collection process. So we want you, actually the HPCSA demands it from you to follow your collection process. And once you've seen that this patient is not going to pay. Now, when I talk about a collection process, I'm talking about, you phone the patient, you phone the family, you phone, their contacts and whoever they have given up as a reference when they were admitted, for instance, or came to see you for the first time. You exhaust all those avenues and then you send a letter of demand. If that patient doesn't pay after their letter of demand has expired within the amount of days that you've given them grace to settle their account, then you can list them on the Codicom website. But what I've seen, we started with Codicom in 2023, like I said earlier, and we were researching and testing and all of those things for months. We only launched Codicom on the 1st of August, 2024. And I had a client that actually had 7 people that didn't want to pay. They were not taking phone calls. They were not responding to emails. The family was not picking up because they saw it's the doctor's rooms that are calling. And so they waited for us to launch. And when we launched, all that they did is they used our letter of demand that we sent in our welcome package to everybody that subscribes to us. They just add one sentence, and that sentence is, if you do not settle your account within the allocated period, you will be listed on the Codicom website, where you will be visible to other healthcare practitioners as a financial risk. That is exactly how it is in the ethical guidelines of the HPCSA as well. So the healthcare practitioners is doing nothing wrong when they say that to the patient.
Yeah.
So those letters of demand were sent out on a Tuesday. I think it was Tuesday, the 4th of August or something like that. And don't quote me on the date, but it was in the beginning of August. So the following day, on the Wednesday, 6 of those 7 people settled their accounts in full. The 7 phoned in and asked for a payment arrangement over 2 months, which they gladly assisted the patient with. Now, this is the best thing about Codicom is, from the healthcare practitioner's perspective, nobody loses when they sign up with Codicom. The total amount outstanding for those 7 letters of demand was about in the region of about 35,000 rand. So just by joining Codicom and sending them the Codicom letter of demand, that guy receives 35,000 rand. So if you put that back into the amount of money that you pay for your yearly subscription for Codicom, it means that this practice got Codicom for free for the next 17 years.
That's
Now that's
insane.
a that's a win-win situation. So that's why, that's everybody that unfortunately, we've become so busy that it's part of the industry that I really like is to sit in front of the healthcare practitioner and
Mm.
share this with them. But
Yeah.
I cannot 49,500 of them in private practice currently. I just can't get to everybody,
Yeah.
but hopefully we can reach a lot of people on your platform now that can understand the value of joining a platform like Codicom. And
Yeah.
also the advantage of Codicom is, we are the only listing industry in the medical or listing platform in the medical industry. There cannot be
Yeah.
another listing platform because it will defeat the purpose of a listing service. So we are the only ones. And our whole website has been designed in such a way that it meets all the ethical, legal requirements. Everything is there. So when you join our website or subscribe to our service, then you can use it with ease, knowing that there will be no recourse for you because everything on our website. If I can use examples like the POPIA Act and all
Yeah.
those requirements, the boxes are ticked. All the boxes are
Okay.
ticked. Um,
That was one of my
okay.
next questions. Yeah, about the POPIA
So
Act and all those
I don't
things.
want to go. I don't want to go into too much detail, but the amount of money that we've spent
Mm.
just on the security of the website and to make it compliant with all the relevant bodies is a lot of money. So,
Yeah.
and as the people sign up, we still at around 75% of all our income goes into security of the website because we work with people's data. So that
Mm.
is first and foremost our biggest priority is to
Yeah.
protect that data.
100%. Thanks, Toppie. I mean, I'm excited just for all those practices that are going to be basically your service pays for itself, 30, 40, 50 times over within a year easily. And I think it's a no-brainer. It's wonderful to see that you've kept, we're not going to mention pricing right now. People can check that out for themselves and it might change by the time someone watches this, but it's super affordable, especially for a practice. And I think, I just love the idea. I mean, from the first moment you told me about it, I thought, jeepers, I got to chat to you about it on the show. It's really wonderful. And I know you also, but not just, I mean, Codicom is your main focus, but also know you're busy with some other projects with technology and maybe you don't give too much away. But what's your feeling about technology in general and AI and the way, the current technologies? Are you optimistic? Are you concerned? Where are you at? And how do you see the future unfolding?
Look, I'm really excited about what I hear, what's happening, especially in the medical industry. With all the new technology that's coming in. I met a person at when I was presenting at the GP Expo at the Stanton Convention Center. And I cannot wait for their product to launch because it's an AI-driven product, with all the rules of the the NHRPL and HPCSA as well, and some are written into their product. So basically, that healthcare practitioner that uses their product will not be able to make a mistake when they use that product because the rules are written in there. I refer to them as EDI systems, all your claim submission systems. I don't want to name names, but everybody knows who they are all integrating AI now. They are busy with their projects to integrate AI. So
No, I'm
yeah,
excited too.
but exciting times to come. We must never lose focus on of why are we doing this. We are doing this to help that healthcare practitioner that sits there with their hands in the air and thinking, how am I going to do this? I'm not trained for
Mm.
this. How am I? This guy's not paying me. What am I going to do now? That is fundamentally why we've started with everything. Even when I still did billing for a lot of doctors, the perception was always, I want to help you. I want to help. I've got so much knowledge. I want to
Mm.
share my knowledge with you. Let me help you. There's a lot of people that full contacts me, and it's still something I do because I love doing it. And to come and evaluate their practices. And, I charge really a small fee for that, but I can, once I've been in your practice and I've gone through your reports and all that and interviewed your staff, I can tell you exactly what is wrong with your practice, irrespective if it's a cardiothoracic practice or a biokineticist practice, and I don't want to sound like I'm degrading the biokineticists,
Yeah, but the range is wide and broad.
that's the point I
Mm.
want to make,
Mm.
very wide range. And because the issues are always the same. That
There's
is
that common denominator.
common denominator. Absolutely.
Toppie, I can't help thinking that you are like the coding doctor in a way. You go there with your stethoscope and on the business and the practice, and you're like, you just text, there's the problem. We need to get
No,
this sorted.
there's actually a lot of people like me out there. There are people out there that are much better than me because they've been doing this for 20 years. I want to urge people to it's not a competition. Let's share our knowledge with each other. I'm not talking about going and do things for free for people. I'm not expecting that, but share your knowledge with each other. So and that's that's one thing about Codicom as well. When you subscribe to us, when we send you our welcome email, the last sentence says we are stronger together.
Mm.
And that is a slogan that we live by at Codicom is we
Mhm.
help each other, we look after each other. And you know what? You briefly touched on the pricing of Codicom. And, I can tell you now, it is so insignificant because when we designed the system, there were a lot of things that we had to take into consideration. And I think the fact that my accountant didn't die of an aneurysm or something is actually a miracle, because I said to him, I am not charging the people more than this. I am not. So we worked out everything. That is the base price, and it's really affordable, like I said, for anybody. Most of the societies charge a lot of money to their members, just to be a part of their society.
Mm.
Codicom it's just like over 100 rand a month. To get
Mm.
financial security for over 100 rand a month it's nothing. It
No,
really is nothing. And the
absolutely not.
best of all, it's tax deductible as well. I don't
No,
want to go
that's
into
amazing.
that. I'm not the expert.
No, that's a story for another day. But the point is, and I think it's helpful, Toppie, that you've had the perspective that you've had. Yes, you probably didn't know when you were still in the police force that you're going to be doing these things. But I think that gave you a perspective of the criminal mind and kind of knowing how to find those people and kind of how do they think. And now the other end, you've seen how with your wife, what the other side, doctors, how they really live and work and what the realities are. And therefore, you are now aligning yourself with medical practitioners, wanting to help them with this very useful tool so that they can have a livelihood and get their money's worth, what they have been studying for, working hard for, and helping people for hours on end. So well done. I think everything's come together for this, for you.
No, thank you so much. Those are very kind words, and it's absolutely, like I said earlier, it's a fundamental thing about Codicom is, we there are so many companies out there, and again, I'm not attacking anybody that says no, we care about the healthcare practitioners. I had a meeting with I'm not going to name the society, but after my meeting with the president of that society, she turned around, she said to me, Toppie, I've never met someone that cares so much about healthcare practitioners as what you do. And you know
Wow.
what, Stian, I almost got emotional because that is exactly why I do that. Yeah, there's a financial aspect to it, and because we need to keep on
Mm.
running, but
Mm.
that is not why Caricom does what they
Mm.
do. It's because I mean, we put our money where our mouth is, and
Yeah.
or where our mouths are. But yeah, so that is
No, that's clear. I mean, the conversations we've had, Toppie, I mean, that's crystal clear, and I think it's refreshing and wonderful to have met someone like yourself and to see just how much you do really care. So I think that has been a very exciting conversation so far. One final question for you, Toppie. Any parting advice for either new or existing practices that you'd like to leave with?
3 words, the same word, 3 times: education, education, education. Socrates said that the only true wisdom is in knowing you know nothing. And when you think about that, yeah, you can be a surgeon that have studied for 13 years, but you know nothing about coding.
Mhm.
Educate yourself, make yourself better. If you work at a doctor's practice or a health practitioner's practice,
Mm.
don't come to work from 8 to 5 and get your salary at the end of the month. Come and be an asset to your healthcare practitioner. Come and better yourself. Ask them, listen, there's this nice course coming up. is a way, you can send me to attend this course or pay for it online for me or something like that. Just by the knowledge that you get from attending those courses. And there are brilliant courses out there. There's brilliant institutions in South Africa. And, with my studies in Australia as well, I saw that, they are a bit better than, than us, to put it mildly. But we've got great.
Just don't tell them what they are.
I was in Australia last year for the healthcare conference, and yeah, you don't give them any credit for anything. They're actually very nice people. So, yeah, just education. Better yourself. See how you can. Because if you better yourself, at the end of the day, healthcare practitioners are so scared to talk about the money aspect of their practice because they feel that they're not allowed to talk about money, and it's completely wrong. It's your source of income, it's your livelihood. Of course you must talk about money. Of course you must plan. And when you invest in people, it's going to repay itself again and again and again, just by the knowledge that they bring and the time that they're going to save you, even if it's only from not writing letters of motivation.
And I think that's a wonderful place to end this conversation. Thank you so much, Toppie. I really enjoyed it. I learned a hell of a lot along the way, and I'm sure everyone watching this has learned a heck of a lot as well. Like I said, if anyone has any questions, please pop it in the comments or get in touch. Go check out codicom.co.za. Is that correct?
That's correct, yeah.
100%. So yeah, you can find out more there.
If I can just say, when you go onto the website, there's a page with frequently asked questions. If you still don't understand what it is that we do, everything is explained to you there. There's how-to videos that can explain to you exactly what we do and how you register the people or register people. When you join our platform, we give you access for 3 people at your practice, which is normally your practice owner and the receptionist and the billings person. It really is for somebody like myself and people that understand this. It's a no-brainer. Join Codicom, because we really are stronger together.
Thank you so much, Toppie. Keep well.
Thank you.
And until next time.
Keep well there. Cheers.